So this video is about Schirmer's test, and it is one of the tests used in eye clinic ophthalmology to look for any dry eye. So patient can come in the clinic with complaining of grittiness, and even they can have a history of connective tissue disorder like Sjogren's syndrome, even any condition that causes dry eye. So what happens is that if there is some problem with the secretion of the aqueous production for the tear, it usually causes symptoms of dry eye. And this Shermer's test is one of the tests which we can do to diagnose dry eye. And till now, there is no standard gold standard test for dry eye. And this is one of the easiest way to make out whether the patient has dry eye or not. And usually we have a strip of filter paper which is calibrated into millimeters, and the filter paper we have to use in both eyes. And usually uh, there are many kinds of tests for Schirmer's test. Also we have Schirmer's test 1, 2, 3. Schirmer's test 1 has without anesthesia and with anesthesia. So what we do is we just take the strip out, and for each eye we have to use 2 strips, so 1 for each eye. And what we do is we bend the end of the strip and put it in the cul-de-sac, most preferably most at the junction of 2/3 to 1/3 of the lower eyelid. And we ask the patient to relax, and we have to keep a timer which is usually for 5 minutes. So in 5 minutes, and after 5 minutes, what we usually do is we measure the how much the filter, how much the strip has been weighted, and we can figure out whether the patient has dry eye or not. So the usual reading is that if it is below 10, the patient has some kind of problem with the related with dry eyiness. So we can supplement the patient with lubricants. And if it is very severe, then we have to do other treatments for dry eye disease. And also we have to rule out any diseases which can cause dry eye, systemic diseases. So this is one of the tests. It is easy to do in our clinic, and it is always better to have this test in our arsenal when you're practicing in your clinic.